Welcome, everyone. Thank you so much for joining us this afternoon. We appreciate you being here. My name is Katie Earle, and I'm the coordinator of the University Express program, and I work for the Erie County Department of Senior Services. We're joined here virtually today with Pastor George Nicholas. I'm very grateful for his time. Before we get to his presentation, we'll go over some housekeeping things because we do have some new folks here today with us, so welcome. First thing I'll let you know is that we are recording this session, and I'll try to post it on our website at a later date. Second thing, which I'm sure you've noticed, is you've joined without a video of yourself showing and you're muted. Nothing you've done wrong, that's just the settings of the program here today. And only Pastor George and I are able to see all of the folks that are in attendance with us today due to an anonymous participation mode. So we hope you send us your questions and comments. You can do that by using our Q&A panel. So for some of you, if you joined from a laptop or computer, that likely popped up on the right side of your screen. You may just have to expand that window so you see your text box. You can send your questions right to me. And if you don't see that, if you look at the bottom right-hand corner of your screen, you might see a box that has a question mark in Q&A. Click on that. Or last thing, if you're on a tablet or a smartphone, poke your screen, your control panel should pop up, and then you can click on the circle with 3 dots. So play around with it. We hope that you send us all of your questions and comments, and again, we'll try to get to as many as we can at the end of the presentation. So I do want to thank the sponsors of our University Express program, my Department of Senior Services, Blue Cross Blue Shield of Western New York, Socio Orthopedics, and Wegmans, because they help make the program possible. And as always, Senior Services is here for you. If you have questions about programs, services, benefits for yourself or a loved one, do not hesitate to give us a call. We're at 858-8526. Without further ado, I will introduce the star of our show today. Pastor George Nicholas is the senior pastor of Lincoln Memorial United Methodist in Buffalo, New York. He has been recognized by the General Board of Global Ministries of the United Methodist for his work on urban ministries. Pastor Nicholas is an advocate for social justice and community revitalization. He is one of the founding members of the Concerned Clergy Coalition of Western New York. He is also a convener of the African American Health Equity Task Force and a member of the Greater Buffalo Racial Equity Task Force, where he chairs the Black Males and Boys of Color Task Force. He's also a member of the Board of Population Health Collaborative of Western New York. We're so glad to have him here today. Pastor, I'll turn it over to you.
Thank you so much, Katie, and thank you, all of you who've had the opportunity to come and join us for a conversation that we're going to have this afternoon. Some of it may be a little difficult for you to hear in terms of the content, but I would invite you to engage in the conversation in a way in which to know that we're looking towards moving forward to make a solution. You know, we're currently if you just are aware at all of what's going on in our society right now, we're really in a season of some really difficult both health issues and certainly issues as it relates to race. Katie, if you could go to the first slide, that's the second slide. I want to point people to our website. Our website, if the Buffalo Center for Health Equity is other way. Thank you. One more, thank you. As Katie was talking about in my introduction, I'm pastor of Lincoln Memorial United Methodist Church, where our mission is changing lives through love. But we've also birthed, and I'll give some more detail about how this Buffalo Center for Health Equity has come to life. And so I would invite you to that you see our website there, buffalohealthequity.org. Please, following the presentation, please log on and you'll learn a lot about some of the work that we're doing here in Western New York. Next slide, Katie, please. One of the things that we did, we're working around doing our work around health equity. We started off our work in conversations about the health disparities that exist here in Western New York. When you look at the public health and health indicators, looking at county and state data, you'll find that African Americans who live in the urban areas, the inner city of Buffalo, suffer some very significant health disparities. And these disparities are rooted in what we will call the social determinants of health. And we'll talk about those in a few moments. But as we did our work, we wanted to move from just speaking around health disparities to speaking about health equity. And so when we're having conversations about race, systemic racism, institutional racism, structural racism, we need to frame it in past, the history, current realities, but we also must speak about where we want to be aspirationally. What do we want our community to look like? So as you think about health disparities, we would like to live in a community where we have health equity, meaning that your race will not be a determining factor of your health. And I'll show you some data, some things as we do this presentation that will show you that race is absolutely, undeniably a factor in the health of individuals, all the way from prenatal to adolescence to teens to adults, and certainly through our senior saints. Next slide, please. Dr. Martin Luther King, he's very famous for a lot of quotes, but one of the things that I want you to draw your attention to is the fact that one of the things that Dr. King said was, of all the forms of inequality and injustice, in healthcare is the most shocking and inhumane. So when you think about all the things that King saw, all the work that he was doing, the things that he saw around the health and the care of individuals and the inequalities and the injustices within that system was the worst things that he had seen. These are rooted in historical context, going all the way back to the enslavement of African people. Going back, I would encourage you to look at some of the work around this work called the 1619 Project, which won a Pulitzer Prize for its work. I mean, there have been some historians that have been critical of its work, of that work, because it's very difficult for us here in America to begin to look at a different narrative, another narrative on the birth and the creation of this republic and the impact that this institution of the enslavement of African people and the impact that it had in terms of building this economy, making the American experiment become a reality. Well, it was the fact that African people were brought here enslaved and worked for free for 250 years, created an economic model that made America possible, right? So when you think about when people came, the Europeans came into this land, it wasn't their land. They took it from the indigenous people, and then they saw though an opportunity for economic advancement. How do we establish a republic here? And the land was very good as it relates to sugar cane, tobacco, cotton, and so these things were where the land was very good for that. However, you needed a labor force in order to make this a profitable enterprise. Their attempts to enslave the indigenous people did not work, and so this notion of there was slavery already in Europe. There was slavery that was happening in South and Central America that actually started back in 1519. And so that was like almost 100-year gap there. And then as we moved up into North America, the enslavement of the African man and woman became a driving force for the economy. When you think about, and it wasn't just the South, when you think about the industries that were created in the North around banking, around insurance, around shipbuilding, those three industries, those industries were funded by the natural resources or the ability to take cotton, tobacco, and sugar and export it back to Europe. And so the ability to do that was it became profitable because they had a free labor force. And when you think about how the financing began to take place, the first collateral in the banking system here in this country were the bodies of African people. So if you had a land and a plantation or something, and you wanted to uh, 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 develop that land so that you could create a cotton or sugar or tobacco, you wanted to went to the bank, the European banks, the banking still was stationed in Europe, and they said, well, what are you going to use for collateral? Well, I have these 10 human beings. And so that value of those human beings would be the collateral in which you could get and buy equipment and do any other things. So and this created laid a foundation for what we'll see now in terms of the health disparities that we'll see. And I'll make that connection in a moment. Please, next slide. And so one of the first things that we did when we created this African American Health Disparities Task Force. That's what it was named at first, back in 2014, 2015. And it was a small group of us who began the conversation at looking at colorectal cancer and the prevalence of African Americans having colorectal cancer. And we said, well, wait a second, let's look at all chronic diseases. Let's see if there's a pattern here of chronic disease and the higher prevalence of African Americans having that. So we looked at we developed and created a report based on state and county data. We looked at 5 or 6 zip codes in the African American community, the East Side. So about 80% of all Black people in the county live on the east side of Buffalo, 14215, 14208, some of these other zip codes. And what we found was that African Americans who reside in those communities have exponentially higher rates of serious and chronic diseases. What would those diseases be? Diabetes, heart disease, cancer, all kinds of disease of that nature, asthma. And they created, and this would create a premature mortality rate, which is alarming at 3%, 300% higher than white. So what that means is that if you're an African American who's living in those communities, you have a 300% higher rate or higher prevalence to have a chronic disease than a white person who does not live in those communities. It's not my opinion. This is what the data has shown us. And this creates what we would call lost years of life. So so when you think about the life expectancy of African, about 4 or 5 years less. So African Americans are living about 4 to 5 years less. But when you drill down and concentrate into these communities, and then you juxtapose them, I know we have some our friends from Orchard Park Senior Center here. So if you look at the life expectancy of a white person who lives in Orchard Park versus a Black person who lives on the east side of Buffalo, the data shows us that that white person will live 10 to 12 years longer than the Black person that lives on the east side of Buffalo. Um, this is I find that to be completely unacceptable, and it's driven by, next slide, what we would call the social determinants of health. Now, when you think about that, so historically, when we've looked at health disparities, there's an immediate jumping to behavior, right? And so, well, when you think about your overall health, this is for Blacks and whites. When you think about overall health, the things that drive your health are what they call the social determinants of health, the social determinants of health. And this definition, again, these are things that come from what we say the CDC, the Center for Disease Control, and then they've been in the news a lot lately. And this definition, it says, the complex, integrated, and overlapping social structures and economic systems that are responsible for most health inequities. Most health inequities. These social structures and economic systems include the social environment, the physical environment, health services, and structural and societal factors. Social determinants of health are shaped by the distribution of money, power, and resources throughout communities, nations, and the world. So what they're saying is your lived environment, right? And it is what is the driving force around health. So when you think about the lived environment of African Americans. And we're going to talk about some other factors, right? The social structures and the existence of systemic racism, right? That systemic racism was built in to the creation of this republic. When you think about the Constitution, right? Even prior to the Constitution, the enslavement of human beings, right? Don't we get this notion that people were enslaved. They were brought here and they were enslaved. They were human beings. And so that's building in a structure, it's building in a system that is built in inequalities, right? And then when the Constitution was created, right, that African people were considered 3/5 of human, right? That not the full humanity was not embraced. So these systems built in to the creation of the republic. And over time, that creates disparities between the social environment, the physical environment, and health services, and the structural and societal factors. So the systems in which we're going to talk a little bit about the distribution of wealth. When you think about African people who were working for free, right, for so long, then there would have been no generational wealth to be passed on, right? So there was labor, there was no compensation for the labor. There was the complete disruption in the dismantling of the family unit. And so it made it impossible to pass resources down from generation to generation, right? And even after the Emancipation Proclamation and after the Civil War, right, the institution of enslaving Black bodies did not cease at that moment, right? So what happened was, and we're all talking about the system, it's systemic here. Uh, they've created these Black codes, these laws, these vagrancy laws, right? So, for example, if you were a free Black man, right, and these laws required you to have a job, and if you did not have a job, then you could be arrested for being a vagrant, for not working, right? And then what happened is when you look at the state of Alabama and other places, these were some of the first places where coal and steel and all these industries began to flourish in those communities before they started flourishing up in Pennsylvania. Uh, these coal mines, the original coal workers, the original steel workers, this was pre-unionized, were actually people who were under the control of the correctional systems of these southern states, Alabama, North Carolina, and there's other places. And then they would sell their labor to private industry, right? So that they could so this notion of enslavement. So it not only fueled the time when there was the American economy was based on exporting of textiles and things like that. But then as we moved into the Industrial Revolution, this free labor was still part of the economic equation, right? And again, this creates this wealth gap, and it's systemic. Next slide, please. So we have Erie County is doing a great work with the Population Health Collaborative, and AARP is doing this great work around livability, right? And trying to create in communities livability for our seniors. And I think it's a great program, and I think it's a great initiative. And then you have the Live Well, Be Well program of Erie County, talking about public health, right? Talking about the health of individuals, right? But again, remember we're talking about the social determinants of health. So when you think about livability, you have to think about those in the context of Black and white, because the livability experience of African American people is influenced by these factors here. We talk about there should be an S in there, so that's spelling error, impact of institutional racism, that there's racism that's embedded in the institutions that govern and run this society. We know this because you had to have the passage of the Civil Rights Bill and the Public Accommodations Bill in 64 and 65, right? Because these institutions were so, there was so much racism embedded in them. And the school systems, right? The Brown versus the Board of Education, the segregated schools, the Dred Scott decision, right? That talked about that there was no right that a Black man had that a white man had to respect. So these things were embedded in the institutions of this country, which led to systemic racism. And then you have an overarching ideology of what we would call white supremacy, meaning, you know, if you think about the doctrine of discovery, these notions where that the European just had this divine authority, a divine privilege, right, to take possession of other people's lands, to enslave other people, and there was even just like this misguided theology, right? That said somehow that this was God ordaining this because of the superiority of the European or the white man. The enslavement of Black folks, the Black codes, we talked about those laws that were written, policies that were written that would diminish the rights of Black people in this country. Jim Crow, for those who grew up in the South. My parents grew up in the South, where you had segregated public accommodations, right? But this was very uh, 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 serious as it relates to education, right? Because education, it helps you move and advance in society. And so when you had segregated schools, and when the Black schools were not given the same resources as white schools, then you had problems. You had segregation also in the South and also in the North. My mother was the first African American school principal in upstate New York, here in Buffalo, New York. And during the time of the school integration project, you know, she would, as a school principal, she would go into communities in South Buffalo and other places, and go to town halls and 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 try to talk to people in these communities about the importance of desegregating schools, right? And so we had segregation right here in the city of Buffalo. Gentrification, redlining. When you think about um, property and redlining, and the redlining was, you know, banks would not lend money for mortgages to Black folks if there was this red line that was drawn around maps, and so Black people could get mortgage. Even with the GI Bill, we probably have some World War II veterans, right? When Black soldiers were only allowed to get uh, uh, access to mortgages and other financial packages from serving in the military through the GI Bill, only to be used in neighborhoods that were Black neighborhoods, and they could not use those. The red lines, these were policies. And certainly, the criminal justice system, we see just tremendous inequalities in that system as well. Next slide. And so what does it look like? And so, Katie, you're gonna have to kind of pop it a couple times and the numbers will come up. So what does poverty and race look like in our region? So here in Erie County, thank you, Katie, that hit it one more time. I think the other number will come up. So when you think about in Erie County, right, whites living in poverty, about 19.7%, about 20% of white folks who live in Erie County are living in poverty, right? Uh, but then when you think about, when you look at, these are City of Buffalo numbers, African Americans living in poverty in the City of Buffalo is 40%. So we have Blacks who live are 2 times more likely to live in poverty, right? And then when you explode that out through the county numbers, well, there's certainly these numbers are there's less white poverty as we move out into suburban areas and what have you. But then the concentration of Black poverty is still. Now, there are areas of poverty, white poverty in rural communities. I understand that and recognize that. But when you look at the prevalence and the numbers, we have a tremendous problem in terms as it relates to poverty and race. Did you know that 4 out of 10 Black people in the city of Buffalo are living in poverty? When you think about the public school system, most of the Black children who attend Buffalo public schools live in poverty, right? In the year 2020. In spite of the fact that we've had over $15 billion of reinvestment in an alleged renaissance in this region, but even during this whole period of renaissance, the Black poverty rate has actually gotten worse and not better. And that's because, again, we were talking about systemic racism. Now, another important point is the distribution of wealth, right? So America, let's go back a little bit. We talked about, African people coming in here, enslaved, right? And that generated, when you exported, when the people who began the American Republic, their economy was driven by the ability to export goods over to Europe, especially cotton was huge because they would have these big cotton textile mills that would produce clothes and things like that were in Europe, and there was a great high demand for cotton in that period of the 1600s and 1700s, and leading up into the industrial age. And then certainly, tobacco and sugar were also very, very important exports, right? And so the economy of America was built up. That's what drove it, right? And that built up power in terms of the banking industries. It created just a financial model that was very, very profitable. So you think about people like George Washington and other plantation owners, Thomas Jefferson and others, and those were the ones we know. These were very, very wealthy men who amassed tremendous amounts of wealth and power, right? And again, when you have that wealth and power, again, it's transferred from generation upon generation, right? And so what happened is from the beginning, there was this wealth gap that existed. And then, you think about as we move into the Industrial Revolution, right? Well, the Industrial Revolution was funded by the resources that were generated during the time of enslavement, right? So there was a tremendous amount of prosperity and wealth that existed here in America, and you can trace a lot of that back to the ability to build an economy with a labor market that you didn't have to pay. Right? You just didn't pay them, right? And so over time, again, the wealth gap persisted. Now, this because of the things we talked about before, redlining, black codes, right? All these other things, the wealth gap, even post-emancipation, right? Even as Blacks began to migrate into the North, right, and began to work in manufacturing and other jobs and things of that nature, and then, as Black folks got access to education and began to operate in the professional class and things of that nature, you still have these huge wealth gaps. One of the things that drives the wealth gap, a couple of factors drive wealth gap. One, income, right? So when you think about income is tied to education. So if you don't have access to high quality education, it becomes increasingly more difficult for you to get a job that will pay more money, right? Then you had the racism that existed in institutions, and especially when you think about the blue collar world. So remember now, we talked about how the first coal miners and the first steel workers and things of this, these were Black folks that were under the quote supervision, but under the control of certain states, and their labor was sold to private industry. Now, over time, when as the Industrial Revolution began to grow, and more prosperity and economic opportunities were available, and then you would have migration coming in from Ireland, from Italy, from all these other places, right? And so oftentimes these folks that came in, this next level of immigrants, were displacing Black workers, right? And then when things began to be unionized and wages began to increase, the Black worker was not included in that mix. And even in the labor movement, which is, there's been labor movement has been good on some things for Black folks, but in other places it hasn't. Things like, creating grandfather clauses, right? So if your grandfather worked in the union, then you came in, then you would get a priority for jobs and things like that. So these were things that were set up in order to keep that level of distance and segregation. And then when you think about home ownership, when you think about developing your wealth, uh, your property, your home is one of your best sources of your wealth. Well, we know that as valuations of properties, right, race is a factor, right? And so if you have a home that's in a predominantly Black community, regardless of its square footage, that same property, uh, that same house might have a twice the value, right? If it's located in a Lancaster or Williamsville, or even on the other side of Main Street. So you had Black families earning money, purchasing homes, but not the value of their property, not getting the same level of equity. Again, that creates creates a challenge in terms of passing on income from generation to generation. A lot of factors here. And so you look here at the chart here, and we see the reality that's going on right now. It goes only back to 1983. And so you see the wealth of African Americans in 1983. Your wealth only $6,800 versus the wealth of a white person at over $102,000. Right. So that's 1983, which is 100 years after emancipation, and yet we still have a wage gap. Excuse me, not a wage gap. There's a wage gap, but I'm talking about a wealth gap that's that high. Fast forward it, the chart shows some of the highest levels in about 2008, 161,000, 10 to 12,000, the gap. Now you see that the wealth gap reduced a little bit in those periods of 2009 and 10 and 12. That a lot of that had to do with the housing boom, housing bust, quite frankly, and what have you. But you see also that the wealth gap, as it's forecasted and projected, you'll see that the gap is still very significant, and even projecting by 2024 that our Latino brothers and sisters will actually have uh, 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 more wealth than Black folks. But even there, the gap is still uh, significant. And this creates a whole host of issues and problems within community. Now, when you think about, next slide, please, when you think about what we were talking about, the social determinants of health, right? And so your lived environment, your educational attainment opportunities, your economic situation and status. Those are things that drive things. So we have to work towards health equity. And so what is health equity? Health equity is achieved when every person, that's very key, every person has the opportunity to attain his or her full health potential. And no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. Systemic racism, institutional racism, and we got to think about this as a system and not as individual behaviors, right? And I'm going to break that down for just in a moment. Health inequities are reflected in the difference of length of life. Well, we've seen the data, right? We've seen the data here in our communities, 10 to 12 lost years of life. Quality of life. Well, we know that there's a higher prevalence of African Americans that are on dialysis, that have multiple comorbidities, hypertension, cancer. And even with cancer, when you think about breast cancer was, October is Breast Cancer Awareness Month. Actually, African American women are less likely to have breast cancer, but more likely to die as a result of it because of lack of access to treatment and other comorbidities that many African American women have. Rates of disease, disability and death, severity of disease. Again, I do work with the Alzheimer's Association. They do fantastic work. And what we're learning is that African Americans are less likely to get early diagnosis of Alzheimer's and other dementias. What does that mean? Well, because the later your diagnosis, then the more severe and more acute the situation is going to be. But if you get early diagnosis, then you can begin to bring in some strategies and things like that to enhance the quality of life for individuals. So one of the primary goals of the National Center for Chronic Disease Prevention and Health Promotion, or organization, is to achieve health equity by eliminating health disparities and achieving optimal health for all Americans. So the Center for Disease Control has part of its organization that talks about the importance of achieving health equity. You can only do that by addressing the social determinants of health. Next slide. So what does that mean? Let me kind of get you to a point where we're talking about what are we doing about some of these things. So when we talk about the health of individuals, we know that your social determinants of health are what drives your health, right? And the social determinants will also influence your behavior. So people say, well, what about your behaviors? But your lived environment has a great impact upon your behavior. Give you an example. So in order to have, you've heard people say that in order to get healthy, you should eat 5 fruits and vegetables on a daily basis and what have you. But if you live in a community where there's not access, you've heard the term food desert. Many Black communities are what we call a food desert, meaning that there's no quality grocery store that's within your community. Transportation is an issue because of the poverty. We have a lot of African Americans who don't have transportation. Public transportation is inadequate within our community. So now you have a community that doesn't have access to fresh fruits and vegetables. So then at one level, you're telling them, hey, you got to eat fresh fruits and vegetables. And then but then there's not the venues within their community in order to purchase this stuff. Then you go back to the poverty thing of those of you who do grocery shopping. One of the ironies and the sad things about society is healthier food is more expensive than unhealthy food, right? And so when people with unlimited incomes have to make food choices, oftentimes their food choices are made by their economic circumstance and not necessarily what would be the best health option for their individuals and their families, right? So you can see how the social determinants of health will drive, behavior. You think about exercising. One of the great things, I have the opportunity to live in a community where you can go out and walk and jog and stuff. There's certain communities that, because of the lived environment, that maybe a woman can't go out and jog in her neighborhood, right? There's all these types of things, limited access to recreational spaces in urban areas in some communities. So there's all these factors that will impact or have an impact upon the ability to engage in the kind of healthy behaviors that you need. So let's talk about for a few minutes, a few outcomes, and then I want to share a quick story with you. Then I want to open up for some questions. So going back, with all this stuff that we talked about, we created this African American Health, at that time, Health Disparities Task Force. We expanded the table, right? So when you think about issues as it relates to race, systemic racism, public health, all these things, these problems were not created by Black people. Therefore, Black people should not shoulder the full responsibility of solving those problems. So what we did was we reached out to other institutions like Erie County Medical Center, the Millennium Collaborative Care, Population Health Collaborative, AARP, SEIU 1199, because they employ a lot of healthcare workers and whatever. And we said, we need your help. We need to develop it. And we reached out to the University of Buffalo but not just to the medical school. But remember, we're talking about the social determinants of health. So yes, we need the medical school, but we also need the School of Management. We need the School of Social Work. We need the School of Education. We need the School of Nursing. We need the School of Architectural and Planning and Urban Planning, all this. And the university said, yes, we recognize these problems in our community, and we want to work with you on that. So what we were able to do is we were able to birth two organizations to work on these issues around health equity. One being the Buffalo Center for Health Equity. And I talked about that's an independent 501 based, community based organization that is going to, I'm going to show you some of the pillars in a minute. They're going to focus on some very important things within the community. And then simultaneously, we created the University of Buffalo Community Health Equity Research Institute, right? And you see on the slide there, President Tripathi and other community leaders, and we were able to open up this institute, which will focus on research. Research is so important because research gives you data, and then data helps you develop policy, and then when you have policy, then you can get resources, right? So you research, data, policy, and then resources, right? And so, and this was major because, there hasn't been a strong relationship between the Black community and the University of Buffalo for a lot of different reasons. But again, because of the power of collaboration, and which is critical, we were able to pull this piece together. And now we're going to have the university working alongside of us to help give us the data, give us the research so that when we come up with solutions to problems in the community, they're science-based, they're data-driven, right? They're data-driven. All too often in the Black community over the years, we have had solutions to social problems that have been kind of right. Here's the example I'll use about this. And those of you who've heard me talk before will heard this. And this is not a shot at anything, right? But for many, many years, and probably some of you who are listening, probably at the beginning of the school year, there's always these big backpack drives. So here's the thing. Buffalo Public Schools right now, if you look at all the data, when you see Business First ranks all the districts, Buffalo, Niagara Falls, Lackawanna, at the bottom of each list. What's common with those three districts? Those districts have large populations of Black children, right? The graduation rate, Buffalo Public Schools, not to the level of Williamsville, Amherst, Lancaster. Only about 30% of Black children are at grade level right now in the Buffalo Public Schools, and this was pre-COVID. So, with this virtual learning, which again, when you talk about virtual learning, right, it revealed that there was there was disparities in terms of access to what? The internet, right? And so it's so deeply ingrained. So having the institution like a university partner with us will help us get the data. So going back to the example of subscribing things. So there's no data that says that Black children aren't doing as well in the educational system because they don't have a backpack, right? I'm not saying there's something wrong with that, but I'm saying the solution does not address the real issue, right? And so oftentimes we allow institutions and organizations to do good charity work, and I'm not against charity, but I'm more concerned with making systemic change and creating an environment and creating community where the parents in these communities have the kind of economic opportunities and employment opportunities where they have enough resources to purchase the things that they need for their children, and then sending their children to world-class schools, right? Listen, there are no schools in Clarence, Lancaster, Williamsville, Kenmore on the failing school list, because you all wouldn't put up with it. My friends at Orchard Park, you wouldn't put up with that. If only 30% of the children at the Orchard Park schools were at grade level, that would last for about 2 weeks. And then there would be complete uproar. Look at what's happening in Williamsville with the challenges around virtual learning, and just how that community's demanding. Said, no, we will not accept anything less than what's best for our children. And so we have to have that same kind of vigor, same kind of standards, and whatever systemic changes we need to make inside and outside the classroom, so these children can have an equal opportunity for success, then we as a community need to do that. And so that's what this we're all about. That's why it's so important. Again, data, research gives you data. The data helps you write policy, and then policy will bring forth the resource. Next slide, please. And so these things, and we're not going to spend much time on it, but these are all the things when you're looking at our community problem solving model. We believe that people within community know what they need, and they know how institutions can help them. So the problem solving model is one in which grassroots community-based people work in partnership with institutional leaders and others to create to put forth solutions and approaches to community problems. It can't be top down, where institutions just tell communities what to do, but they can't just be community based, because the communities won't have access to the resources to implement the good ideas that may come up. So there has to be a partnership. Next slide, please. So the Center for the Buffalo Center for Health Equity, these are the 5 pillars in which we're going to be working on. Again, we're going to have a research component of it, because it's going to be community participatory research. But we're going to work in partnership with the university research team to help drive research. Policy development, public policy influences the conditions of human beings, right? Advocacy and communication, community engagement, and the neighborhood development. So these will be the 5 pillars, the 5 strategies that we will approach. And our goal is to, and we're very clear about it, to eliminate race-based health disparities. We don't believe that, and I think you don't believe this as well, that your race should be a major factor upon the health that you have as you live in this country. Next slide, please. Real quickly, these are our core values. I'm going to read through them real quickly. People have the right. This is a human right. The World Health Organization, it says that to be able to live a healthy life, that's a human right, right? And so if there are things that are impeding your ability to live a healthy life, right, then we as a community must address those things. Our work, we cannot be afraid to talk about race, to talk about race in the context of systemic racism. See, one of the things that blocks us from talking about race is because we frame it too much in individual personal behavior, right? I'm talking about systems, racist systems, which create these disparities, right? And so a lot of times whites are afraid to have these conversations, or recoil from these conversations, because they may not personally feel any racial animus towards people. But we're all part of a system, right, where these racial problems exist, and some have benefited from the system, and others have been hurt by the system. So we need to figure out a way to change it. Next slide. We believe in inclusivity, accountability, and humility. Again, these are the core values that drive our work. Next slide. And these slides are gonna be posted. I know I'm going very quickly. And then these are 8 work areas. When we're talking about health equity, we're talking about historic trauma, policing, maternal health, restorative justice, mental health, tobacco reduction, nutrition, and wealth building. These are 8 areas in which we're working on right now. But real quickly, when we think about policing, Buffalo, we have one of our teams is a fines and fees team. We looked at the fines and fees that were happening in the city of Buffalo for non-moving violations, traffic violations, like busted headlight or tinted windows and stuff like that. And we found that in those same neighborhoods where we saw those worst health outcomes, there was a disproportionate amount of people who were ticketed in those communities. Now you already have poor folks in these communities. The last thing they need is a $75 ticket for some nonsense. And it was a way in which the city of Buffalo was actually generating wealth, generating revenue. Well, we took that on and we worked with folks. And just recently, Mayor Brown and the council rescinded 13 of those fines and fees. So that was a tremendous success. Next slide. And again, this Buffalo Center for Health Equity, we're community driven, committed to structural change. We want to address root causes. We want to change the narrative. We want to cultivate inclusivity. We want to raise consciousness, right? We have to change the way we think about the issue of systemic racism, of institutional racism, because when we change our thinking, then we'll be open to more progressive, more effective ways in which to bring equity within our entire society. Next slide. Real quickly, because I know I want to leave time for 2 minutes on this. So COVID-19, here's a classic example of how systemic racism works, social determinants of health, whatever, all these things that we've been talking about. So when we looked at COVID-19, when COVID-19 hit the country back in January, but we weren't told about it until March. So in March, when we realized that COVID-19 was hitting the country, we knew because of the social determinants of health and health disparities that Black people were going to be hit hardest by this COVID-19. We knew, because we already had the data, that there was a higher prevalence of diabetes, heart disease, and asthma, which were 3 comorbidities that made people more vulnerable to COVID-19. We also knew that a lot of the essential workers, the frontline workers, right? There was a lot of conversation about essential workers, and there was a lot of focus on doctors and nurses. Yes, they were there. But also in these hospitals, you had a lot of other hospital workers. And a lot of these workers were people from the Black community. And they didn't have the access to the PPEs. They were riding public transportation. So the early numbers that came out around COVID-19, we saw the highest rates were coming out of neighborhoods and communities right here on the east side, those same communities that we talked about that had the 300% higher rate for chronic diseases. So the early data from the county showed exactly what we suspected, that Erie County Blacks make up about 14% of the county population. 30% of the early deaths came from the African-American community. That's about 2.5 to 3 times the ratio. This trend is happening all across the United States of America and is staying at that level. So when you look at those numbers about COVID-19 deaths, the 215,000 of those, a disproportionate amount of those numbers are people from the African-American community. Data shows that. So how do we respond? We wanted to develop a meaningful collaboration with local government officials, faith leaders, private sector, labor, and other service-based organizations. This was key. Next slide. So these were our partners that we developed, we worked with, and we brought these partners around the table. The county executive showed tremendous leadership. I'm not just saying this because I'm on a county call. and was really open because they didn't really know what to do at this time. I mean, people were really, and without having that knowledge around the health disparities, the county wouldn't have been prepared to make sure that we had a response that was targeted towards the community that was most vulnerable, right? Not taking any resources from, Lancaster, Depew, Waitsville, no, but making sure that the areas that we know from data, from research, that are going to be hardest hit, that we make sure those communities have access to the resources that are needed. Next slide. And so we established this COVID response team, uh, 15 churches calling people within these communities, in these targeted areas. We're getting people PPE. We're getting people signed up for testing. We're getting people food because a lot of people were because of the economic situation in COVID-19, there was a huge a number of people that were food challenged and they needed healthy food. They didn't need food that was going to feed the disease, right? So a lot of times with some of these food giveaways, while people are grateful for the food, but some of those things, the last thing you want to do to give to a community that's already dealing with hypertension and diabetes and all these other health problems is a bunch of canned processed food, right? Because a lot of those foods, they feed the diseases. So we worked on getting healthy food to people. And I want you to look at this data, look at this graph. And I know it stopped in June, but the numbers are still trending the way that we want them to trend. Here in Erie County, you see back in April, again, the number about 33%, population 14.6%. That's 2.5 times, that's a definition of a disparity right there. And through our work, through working with a lot of our collaborative partners inside the community, within institutions and what have you, we were able to drive that number down to about 16%, and I think it's below that now, which is right almost in alignment with the county population. We're one of the few communities in the United States of America that can show that kind of progress. Next slide. So that's my story, and I'm sticking with it. I'm going to open up for some questions now. Let me just say this: that this talk, probably the topic that we're talking about really is a conversation that really we could really schedule 20 hours, and we would get into it, but we would be so much ground to cover. So I know I went really fast because I'm trying to give you an overview. Really, what I want you to do is I'm really trying to perk your interest to dig deeper on these issues on your own. Katie's going to send every participant here a bibliography of some fantastic books that are out there now that will help shape and help you in your understanding about systemic racism, the historical impact it's had in America, its current practice, and some steps we need to make or need to take in order to eliminate systemic racism within our country. And specifically, how there's some things on there as it relates to theology. I didn't have time to get into that today. We got to think about, ways that we think differently about God and how we just really have to change our thinking. So there's a lot of books and there's a lot of data on there that will help you. So I would invite you to, peruse the bibliography and take an opportunity to read a few of those books, and then engage in conversations across ethnic lines. We are so segregated. Buffalo is one of the most segregated cities in America. One of the things that breaks my heart the most is when I do a funeral, and my congregation is mostly Black, but I have a few white members. But I've also done funerals for people from all ethnicities, and and the saddest thing is if I do a funeral for a white person and nobody Black shows up to their funeral, which is really interesting because in our culture, the Black community in general, I'm making generalizations, that we will go to a funeral or a wake for someone that we just tangentially know, right? I mean, we don't have to be really close to somebody to go to their funeral. And it's sad that you'll see people who have lived 80, 90 years and they've never developed any kind of relationship with someone in the Black community. Um, don't do that. Get out of your spaces, get connected to people from different cultures so that when we have conversations about race, you'll be able to hear people. A lot of times people in the white community don't hear us when we talk about these issues because they have had no connection. They have no, they go by what they see on television or what, I don't know. But get in a relationship with folks. I tell people, one of the things that can happen right now is, I'm a minister, a Christian minister, and, get out of your white church and go join a Black church. Go join and get involved, or at least visit and go get to know people who share your same faith tradition, right? Uh, and get to know folks, and get to know communities, and so that we won't continue to live our lives in these silos, and it makes it so difficult for us to come up with solutions. So I'm going to stop right there. And I got about 5 minutes. Probably don't. No, it's after 3. I'm sorry. Um, for some questions, but if you put them in the chat, I'll get back to you.
Pastor George, I want to thank you so much for your presentation and sharing that and having this conversation and starting this conversation for us. Everything you said is so important, and I'm just really appreciative of it. And we do have some questions and comments. I know we're an hour, but if you can give us the time, I'd really like to run through some of these. And for University Express, I hope this is really only the beginning, because we do need to be talking about this stuff and need to be connecting. So thank you. Now, if
Thank
I'm
you.
happy to
I
read
got about
these
10
questions
minutes.
All right, just quickly.
Yeah.
Well, we have a comment here. Thank you for explaining systemic racism so well. It's very powerful. Another question I'm seeing, and you kind of touched on it, but what can we do to help the cause?
Well, I think one, get the bibliography, and begin to start doing some reading from scholars about some of these issues. Understand the issues of race in the context of systems and not individual behavior, right? And so understand how things have worked systemically, so that's important, because it takes away that, well, I'm not racist because I went to, like my coworker's Black and I went to the Bills game with them. That's great. That has nothing to do with systemic racism, right? And so look at things from a systemic way, and then making it be intentional about connecting with people from, if you're white, from people in the Black community. I mean, be intentional about it, right? And find spaces, you know, and then be willing to sit and to listen and hear people, and be willing to have difficult conversations, right? And be able to hear, people's experiences, and not, interject yourself. One of the things that really hurts dialogue around race is that when we have these conversations, there's a tendency for white people to center themselves in the conversation and not just let people, Black folks, talk and share their experience, talk about what their lived experience is, and not try to diminish it, not try to say, oh, you're overreacting. Oh, I don't think it was what that person was thinking. I don't, no, don't center, don't engage, or don't say, well, I had the same experience and I'm white. And so that means that therefore it couldn't have been racism, right? No, just don't put yourself in our story. Let us own our story. Let us tell our story. And then let's move forward so that we can talk about how we can bring equity into society.
Thank you for that answer. Another question I'm seeing, In terms of wealth building, why isn't there more education on the true costs of using rent-to-own type arrangements, as well as the cost of paycheck loans?
Yeah, yeah. Well, let me ask you that. How many rent-to-owns you see out there in suburban communities and things like that? And paycheck places and all. They're intentional about putting these types of things in poor communities. Yes, I mean, I can't tell you. I mean, there's lots of whys, but I think these are types of things that suck wealth out of communities. You see these commercials where people say, if you got a settlement, go get this money. All that is it's a loan, it's a high interest loan based on what you're gonna get, and you're gonna end up, but they target people with this kind of nonsense. So thank you for that. Yeah, I think, I'd like to get rid of all those places out of communities so that we can, because there are ways in which they're just sucking wealth out of the community. But we need to teach, one of the things, final point is we need to teach more about economics, how the economic system really works, right? Um, we really don't do that. So we live in such a consumer-based society that we don't teach the values, especially in urban communities, about how the economy works. I mean, and the importance of investment and savings and just but then there are also these taxes, right? In terms of, I call it a ghetto tax, where if you're Black and you live in an urban community, your car insurance is going to be significantly higher than if you're a white person that lives in the suburbs. It's just a fact. Look it up. If you don't believe me, look at the data. And so again, that's another way of just sucking income out of the community. Good question.
I'm seeing two more quick questions. The role of jobs leaving area and being a global market, how is this impacting?
The skills gap. I get calls frequently from manufacturers. There are companies right now. General Mills is hiring right now. Rosina Pasta, the owners there call me all the time, looking for people, right? But here's the problem. There's a tremendous skills gap that exists within the community based on race. So for example, we all know, we've heard about the Northland Training Center. It's a great facility. It's great. It's a great idea. Supported 100%. But again, let's go back to the educational system. So we have so many children that have gone through the Buffalo Public Schools that just really didn't get the best education they could have. And so you see those billboards. Sometimes they say, "Hey, come to Northland Training Center and do this thing. You can get this welding job and all that." And these jobs are out here, right? But when you get there, you just don't walk into the trainings. The trainings, you have to take a thing what they call the TAVE test. What's the TAVE test? The TAVE test is a basic skills thing that you really have to know 8th grade math, basic algebra, right? Uh, and sadly, the vast majority of the Black folks who come into the Northern Training Center to sign up, they're going to make $70,000 a year, and they have these high hopes and whatever, and they sit down and they take that TAVE test, and they're not able to pass it. Is that their fault? They were put into a system, right, that did not provide them the educational opportunity that they should have gotten, right? And so when you see that, and when you see the numbers when that happens, so I mean, right now there's whole schools that haven't that no kid passes the state exams. The whole school, right? And then we can't play this thing about, well, blaming this person, blaming that. Everybody's responsible, so let's fix it. Let's fix it, right? So yes, there's global opportunities, markets. There's high tech stuff going on now. Even at McDonald's, you got to know how to use the computers and stuff like that. And so it's critical that we make sure that children are getting the kind of education that they need, so they'll have the skills, right, to move into these light manufacturing or even more highly technical jobs so they can make a living for them and their families. But the skills gap is a critical thing. So you have the big training center over there, but most of the people who go through that training center are not people from that community.
Thank you for answering that. I just have one more quick question for you. Are you available for speaking engagements?
Yeah, we'll see. Yeah, it depends. It depends who. Yeah, sure. I mean, if you could reach out to me and, you know, yeah.
Okay, and then we'll end on this comment. Thank you for a well-prepared presentation. Learned so much today. Thank you for all your work, and I hope to help promote the vision.
Well, it's up to you. I mean, each person can play a part, and just think about. I would ask for that again. Read the thing. Think about your circles. Think about the people you spend the most time with. And if the people you spend the most time and if nobody from another culture is part of that circle, you need to expand your circle, man. Because you're missing the boat, and then you're just gonna base what your knowledge. One of the biggest liars is the television, man. You can't believe anything on the TV, right? And so if you think you understand Black people, because you watching some show about Black people on television, come on, talk to people, be a part of them, get connected with people. That'll make a difference.
Thank you. Thank you for your
You're
time.
welcome. God bless all of you, and anything I can do to help. And please go onto our website, buffalohealthequity.org, and get some more information. And please take the bibliography seriously, and do some reading and preparation and study.
Absolutely. Thank you. Everyone, I'll send that to you within the hour once my list gets generated. And Pastor, thank you. I'll be in touch with you offline. And everyone, I hope you have a great rest of your day. Take care.
Thank you. All right. Bye-bye.